sexually assaulted, a clock starts ticking for evidence collection, and all they want to do is shower, brush their teeth, or curl up in a ball.
But if they really want to build a case against their attacker, they've got to go to the hospital, and not just any hospital. ABC2 News investigator Josie Sturman discovered the system for victims is filled with roadblocks that may keep them from trying to move forward.
In the last 3 years, nearly 4,000 people have gotten rape kits at the Maryland hospitals prepared to handle victims of sexual assault. But not all of our hospitals are prepared. And advocates say that puts us all at risk, giving perpetrators the chance to walk free if evidence isn't collected. For Kate Rush Cook, this past summer was an anniversary. There was no reason to celebrate, but she had to look back, 20 years back, to August 1993.
I was just having fun with my friends that summer, and that girl died that night. And I became the person that I am now.
The woman Kate is now is a storyteller, a source of strength, and a rape survivor.
I ended up being kidnapped by him, taken to a second location, and repeatedly raped.
Kate talks about that night in August as a way to let her experience go. She says the rape itself was understandably traumatic, but the exam that followed was no better.
It's a humiliating process. You are treated as a crime scene, because essentially that's what your body is. That is where the evidence is.
And collecting it piece by piece is what it takes to pursue a case. It's a victim's personal version of CSI.
Not to be graphic, but we've all been on the tables. Think about what that means. You're going to get evidence collected. You actually have to go to the right hospital.
There is a difference between right and wrong for rape survivors in Maryland. The right hospitals in this case provide forensic exams. The wrong ones don't. And Lisa Jordan with the Maryland Coalition Against Sexual Assault says some victims find out the hard way.
A woman had been brutally assaulted. She showed up at the wrong hospital. She had a pelvic exam and she had medical treatment, but she didn't realize that she wasn't getting a forensic exam. So evidence was not collected and the case was not prosecuted.
It's the worst case scenario for a system victim advocates believe can be bad for survivors who never expected to be victims and don't know where to go. The way it works now, only one hospital in Baltimore City and generally only one hospital in each county is designated as a safe hospital with specially trained sexual assault forensic examiners. ERs elsewhere, even those considered top-notch, don't have the staff or equipment to do these specific exams. So after experiencing a trauma, victims may be transported elsewhere or sent on their way, potentially abandoning the exam altogether.
I think it's shocking to people when they realize that not every hospital is providing these services.
But Delegate Ariana Kelly wants them to. A rape survivor herself, she's proposed a bill that would require any hospital that offers emergency services to also provide forensic exams.
The last thing we need to be doing is creating a system that ends up punishing a victim of a crime or putting the burden on the victim of a crime to get the health care and medical services that they need.
But services are different depending on which safe hospital a victim ends up in. Some do the exams right in the ER. Others, like GBMC, have a designated suite, providing privacy, comfort, and even clothes for the victims as they go through an invasive exam with law enforcement standards.
This never leaves our person.
Forensic nurse examiner Linda Kelly is the SAFE coordinator at GBMC. She considers its program, labeled the Center of Excellence, a model for how survivors of sexual trauma should be treated. And she's worried if every hospital is asked to do forensic exams, quality for victims may suffer.
I think it is a naive view, and I think what is happening is folks that are not doing this work are missing the unintended consequences of taking such a broad brush approach.
Kelly brings up potential ER wait times for victims and a lack of privacy for their exams. She also questions the potential for different protocols and whether cases could be jeopardized if evidence isn't properly collected. It's an issue prosecutors like Baltimore State's Attorney Greg Bernstein say needs to be considered with this kind of bill.
If you are going to go down that road, you just need to make sure that whoever is doing the examinations are, in fact, properly trained.
But training is already an issue. So is recruiting, according to people on both sides, who say forensic nurses are hard to find, with some designated hospitals struggling to staff their SAFE programs.
So if they bounce you around from hospital to hospital, getting you to the right place,
That could be devastating. I mean, absolutely devastating.
Inflicting more trauma on a victim who's already gone through hell.
The system has cracks in it, and it needs to be fixed.
Delegate Kelly says her bill would put pressure on hospitals to build a system so they're ready for every victim. But she doesn't have a stance on how that should happen. So hospitals could either train their own examiners or work out a system where forensic nurse examiners move and respond. Have nurse will travel, so to speak, which is what states like New Jersey already do. Delegate Kelly, though, will likely need the support of the Hospital Association and the Maryland Health Department to move forward. The association ignored our request for comment, and the health department said it would make its stance public at a bill hearing tomorrow in Annapolis. Josie Sturman, ABC2 News.